Hi everyone. This is just a brief summary on spinal cord injuries. Spinal cord injuries are disruptions in communication between the brain and the rest of the body. So there's a damage in the spinal cord, and when the brain sends signals to the spinal cord cannot relay those signals to the rest of the body. So there's that disruption in communication between the spinal cord, the brain, and the rest of the body. Okay, so if the brain signals the bladder to empty itself because of a spinal cord injury, the bladder may not be able to empty itself. So at that point, the patient start retaining urine. They are there are there are two major types of spinal cord injury, which is the complete spinal cord injury and incomplete spinal cord injury. Complete spinal cord injury just says that there's loss of motor or sensory function um, below the level of injury. So there's no communication between the brain and the affected part of the body, okay, or affected parts of the body. Incomplete, there's still some preservation, there's still some communication going on, but not much, okay, and it varies depending on where the damage is, the neural damage is. Common causes of spinal cord injuries are motor vehicle accident, gunshot wounds, for those who are interested in trauma care. Gunshot wounds, motor vehicle accidents, these are traumatic spinal cord injuries, or maybe a stab wound or something like that. Oh, fall, yes. A fall too can also cause a spinal cord injury. Uh, Non-traumatic spinal cord injuries will be things like tumors, infection, or maybe some kind of degenerative joint disease. So those could be non-traumatic causes of spinal cord injury. So treatment and care will be based on where the particular injury is. Okay, so I encourage you to look at your spinal cord and see how your spinal cord is, and the different sections of the spinal cord, like the cervical, the thoracic, the lumbar, and all of that. Just go look at those different sections of the spinal cord, and as you study, think of it anywhere around. So there are some spinal cord injuries that the patient will be completely paralyzed, like quadriplegic. So it's like that will be a spinal cord injury anywhere around the cervical area, where it causes paralysis, like from neck down. So quadriplegic or tetraplegic. So all these limbs, everything is paralyzed. So this will be like injuries above C3. Okay, injuries above C3. If there's any impairment in injuries above C3, we can have a quad patient. They're completely paralyzed, so they cannot use their hands, they may not be able to use their legs and all of that. And then think of it, if that is the case, okay, what are some of the your what as you care for your patients, what are some of the things that you think will be like priority for these patients? Okay, so we're starting with C3, cervical area. Where is the neck? You see this, you have your trachea here. So would that cause breathing issues? Again, remember I said these videos are just to enhance your critical thinking. So airway, your airway. So you have patients with a lot of breathing issues, could be impaired. Okay, and also because it's a quad patient, they're paralyzed from neck down. I'm trying to think, it's a quad patient, they're paralyzed from neck down. Bladder wise too, they may not be able to empty their bladder, so such patients will benefit from maybe a chronic Foley or a suprapubic catheter, to be able for them to, because they'll continuously have a urinary retention, and then of course that is a breeding ground for UTIs and all of that. Then after your cervical area section of the spinal cord, we have the thoracic. Okay, so your cervical area starts from C1 to C8. Then T1 to T12 is your thoracic. Okay, this is now around the chest area. Yeah, the chest area, thoracic, T1 to T12. So for these patients, they'll be paraplegics. Okay, so which means that they'll probably be paralyzed from waist down. Okay, but their hands will be active. Okay, so it has nothing to do with the arms. The arms are fine, but they are paraplegia, paraplegic, so they are paralyzed now from their waist downwards. Okay, that again will be from around T1 to T12. Lumbar, the next section will be your lumbar area. Lumbar area is from L1 to L5. That's the location of where your bladder is, your lumbar right there. That's the location of where your bladder is. So the legs will be affected, bladder will be affected, and bowel control. So your patient will not be able to be incontinent to B and B, bladder and bowels. Okay, so these patients will now no, they'll benefit from not necessarily incontinent. Let me take that back. So of course urinary retention, because of again is lumbar 1 to 5, L1 to L5, bladder and bowels are affected. So therefore patients will benefit from either Foley catheter, suprapubic catheters, or they'll have a colostomic site. Okay, they'll have a colostomic site where their bowels are rerouted through the stomach. Okay, or they'll have an ileostomy or colostomy. If it's an ileostomy, you expect liquid stool, because it's where if it's a colostomy, then we expect hard stools and all of that, which that's not what we're talking about. So your cervical, your thoracic, now we're getting a lumbar. Then the last section will be your sacral area. Again, your sacral and your lumbar, they are almost around the same place, so we'll still expect bladder retention, we'll still expect impairment in the bladder and impairment in the bowels. And then, but for your, this is remember this, for that sacral area, that's where your genitalia is located, right? So our patients now at this area, they may have sexual dysfunctions. So as you care for these patients, especially, it doesn't even matter the age, but as you care for these patients, you have to bear in mind that they may have those, your patient may be wondering that, will I be able to have any kind of sexual activities again and all of that. So this is when now you start using your critical thinking. There are other ways for you to derive pleasure and all of that. All of that is in your notes and your textbook. I'm just trying to spark your critical thinking. So this is just a brief summary of a spinal cord injury, the location of spinal cord injury and all of that. So now that I've given you from C1 to C8, which is your cervical area, this is your quad patients, okay. Then T1 to T12, that's your thoracic area. This is where they are paraplegic, which means they are paralyzed from waist down. Paralyzed from waist down for your thoracic. Then your lumbar, which is L1 to L5, that's where we have the bladder, the bowels and all of that. Then finally the sacral area, which is S1 to S5, is also, the bladder is also affected here, and then the bowels are affected, then plus sexual dysfunctions. And as a nurse, you have to, as you do your care plan, you have to incorporate all of that into practice and how you'll be able to manage your patient's anxiety and answer their questions in relating to this. So now I'm just thinking of, yeah, so okay, so now let's talk about T3. Okay, we've already established that T3 is the thoracic, and this is our paraplegic patients. Okay, so a T3 patient with like a headache, if you have a T3 patient with a headache, so what will be some of the things that you'll be thinking of as you care for this patient? If a patient complains of a headache, we just did a neuro lecture, okay, check their blood pressure. Okay, check their blood pressure. If the injury is anywhere around T6 or up or higher, okay, T6 or higher, these are our patients that We've not covered shock yet, but this is our patient that will easily go into neurogenic shock. Okay, and neurogenic shock, I'll just touch that a little bit because we're here. Neurogenic shock, some of the signs and symptoms of neurogenic shock is bradycardia and hypotension. Okay, so every other shock your patient is experiencing tachycardia, but from neurogenic shock they'll lose sympathetic tone. That's why now they become brady instead of tachy. Almost every other shock patient, they have cold and clammy skin. Neurogenic shock, your patient is warm. Okay, so we are on spinal cord injuries. So for your T3, if your patient complains of any kind of anywhere from T6 and up, if your patient complains of headache, because now I've introduced you to neurogenic shock, your patient complains of any kind of headache or anything like that, check their blood pressure. Okay, check their blood pressure because they could be going into neurogenic shock. And also autonomic dysreflexia. Well, that's a big term for spinal cord injury. Look it up, autonomic dysreflexia, which patients just have like uncontrolled blood pressure. And this uncontrolled blood pressure could be because there is it could be because the bladder is full. Okay, the bladder is full, so, or there's having some kind of restriction because they have a spinal cord, they start with a spinal cord injury, then suddenly the bladder is full, maybe the catheter is kink, so the bladder is full and is backing up. Your patient can go into autonomic dysreflexia where they just spike like an outrageous high blood pressure, like maybe 240 over 180. Okay, and then sometimes if you're focusing only on medication, you start giving medication in a situation like that, it may not even be beneficial. It may help, but not a lot. If it's that autonomic dysreflexia came because the bladder was kinked, you have to literally unkink that bladder for that urine to flow, then the blood pressure will start dropping. Okay, so for these particular patients, we see they experience like a pounding headache. Okay, so if your spinal cord injury patient is experiencing any kind of headache, you start thinking to yourself, what are some of the things in my environment that I can do to control this headache? Okay, do you want to dim the lights? Do you want to reduce the noise? And what are some of the things around that can be done? So I mentioned incomplete spinal cord injury. Okay, so if a patient has like an incomplete spinal cord injury lesion, maybe just say at T6, T7 or T8. Okay, if it's specifically at T7, they'll have a syndrome that we call Brown-Sequard syndrome. Okay, if that injury is at T7, they'll have Brown-Sequard syndrome. Overall, for spinal cord injury, because the spine is so delicate, we want to make sure we're positioning these patients right. So if you suspect that patients have any kind of spinal cord injury, we want to make sure that spine is aligned because we don't want to make things worse for the patient. So positioning is very important. So this is where we have lock roll. So 2 nurses on each side. We're doing a count 1, 2, 3, and we're rolling that patient as a unit so we can be able to align that spine. Okay, so what else? What about cervical? Okay, we already mentioned that for your cervical patients, if they have a spinal cord injury anywhere from the cervical starts from C1 to C8, these are your quad patients. Okay, they're paralyzed, complete, total paralysis. So always assess respiratory rate. Always assess the respiratory status for your patient. If they have any kind of injury in the in between C1 and C8, assess respiratory status. And because it's just a cervical injury, okay, they are not yeah, access respiratory issue, anything respiratory becomes very critical for your patient. Okay. I think I've gone almost 15 minutes. I think I'll stop right here. This is just an overview for your spinal cord injury, complete and incomplete spinal cord injuries. We start from cervical, thoracic, lumbar, and sacral. Okay, also something comes to mind, like for thoracic, which they are paraplegics, right? They're paralyzed from waist down. Just make sure that if your patient is paralyzed from waist down, assess the bowels, assess urinary, okay, assess urinary no urinary function, because they probably must have lost they'll have a suprapubic catheter or or a Foley catheter. And put them on continuous cardiac monitor. Spinal cord injuries, one, I'm just getting general things. We want to keep them on continuous cardiac monitoring. We want to keep respiratory issues. Yeah, I think fatigue. Let me stop here. So yeah, this is just a general review of the spinal cord injury. If you have any questions, I'll be available this week on Saturday to answer your questions.